This presentation is on sleep apnea. Sleep apnea is a potentially serious sleep disorder. It causes one to temporarily stop or decrease their breathing repeatedly during their sleep. There are several types of sleep apnea, but the most common is obstructive sleep apnea. This occurs when one's throat muscles intermittently relax and block the airway during sleep. When the muscles relax, the airway narrows or closes as you breathe in. You can't get enough air, which can lower the oxygen level in your blood. Your brain senses your irritability to breathe and briefly rouses you from sleep so that you can reopen your airway. This awakening is usually brief and is not usually remembered. You might snort, choke, or even gasp. This pattern can repeat itself 5 to 30 times or more each hour, all night long, impairing your ability to reach the deep, restful phases of sleep. Another type of sleep apnea is central sleep apnea. This occurs when your brain doesn't send proper signals to the muscles that control breathing. This causes you to make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficult time getting to sleep or staying awake. Another type is complex sleep apnea syndrome. This occurs when someone has both obstructive and central sleep apnea. The signs and symptoms of sleep apnea are the following: loud snoring, gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep, excessive daytime sleepiness, difficulty paying attention while awake, and irritability. Factors that increase the risk of sleep apnea include the following: excess weight. This is because fat deposits around your upper airway can obstruct breathing. Neck circumference. People with thicker necks might have narrow airways. A narrowed airway can be a risk. One might inherit a narrow throat, or tonsils can be enlarged and block the airway. Men are 3 times more likely than women to have sleep apnea. Older individuals are shown to have more sleep apnea. Having family members with sleep apnea may increase your risk. The use of alcohol, sedatives, or tranquilizers can relax the muscles in your throat, which worsens sleep apnea. Smokers are 3 times more likely to have sleep apnea because smoking can increase the amount of inflammation and fluid retention in the upper airway. Nasal congestion, congestive heart failure, a stroke, or the use of narcotic pain medications such as opioid can all increase your risk of sleep apnea. Sleep apnea is a serious medical condition. Complications that can occur are the following: daytime fatigue. The repeated awakenings make normal restorative sleep impossible, making severe daytime drowsiness and fatigue likely to occur. High blood pressure or heart problems. Sudden drops in blood oxygen levels that occur during sleep apnea increase blood pressure and strain the cardiovascular system. Type 2 diabetes can occur. This is because sleep apnea can increase your risk of developing insulin resistance. Metabolic syndrome can occur. Complications with medications and surgery. For example, people with sleep apnea might experience complications after surgery because they are prone to breathing problems. And lastly, liver problems. People with sleep apnea are more likely to have abnormal results on liver function tests. Your doctor may make an evaluation based on your signs and symptoms and a sleep history. You can also be referred to a sleep disorder center. There's a sleep specialist that can help determine if you need further evaluation. An evaluation often involves overnight monitoring at a sleep center of your breathing and other body functions during sleep. Home sleep tests also might be an option. And then the 2 tests to diagnose, to detect sleep apnea, are the nocturnal polysomnography and home sleep tests. For milder cases of sleep apnea, a doctor may recommend only lifestyle changes such as losing weight or quitting smoking. If you have nasal allergies, your doctor will recommend treatment for your allergies. If these measures don't improve your signs and symptoms, or if your sleep apnea is moderate to severe, a number of other treatments are available. Certain devices can help open up a blocked airway. In other cases, surgeries might be necessary. For therapies, there is the CPAP, oral appliances, or other airway pressure devices. If you have moderate to severe sleep apnea, you might benefit from using a machine that delivers air pressure through a mask while you sleep. With CPAP, the air pressure is somewhat greater than that of the surrounding air and is just enough to keep your upper airway passages open, preventing apnea and snoring. Although CPAP is the most common and reliable method of treating sleep apnea, some people find it uncomfortable. Some people give up on the CPAP machine, but with practice, most people learn to adjust the tension of the straps on the mask to obtain a comfortable and secure fit. You might need to try more than one type of mask to find one that's comfortable. Don't stop using the CPAP machine if you have problems. Make sure you go to your doctor to see what changes can be made to increase your comfort level. Additionally, contact your doctor if you're still snoring or begin snoring. If your weight changes, the pressure settings of the CPAP machine might need to be adjusted. Another option is wearing an oral appliance designed to keep your throat open. CPAP is more reliable and effective than oral appliances, but oral appliances might be easier to use. Some are designed to open your throat by bringing your jaw forward, which can sometimes relieve snoring and mild obstructive sleep apnea. If using a CPAP machine continues to be a problem for you, you might be able to use a different type of airway pressure device that automatically adjusts the pressure while you're sleeping. This can be a unit such as the bi-level positive airway pressure or the BPAP. These provide more pressure when you inhale and less when you exhale. A couple different surgeries can also be beneficial. Surgery is only an option after other treatments have failed. Surgical options may include tissue removal, tissue shrinkage, jaw repositioning, implants, nerve stimulation, or creating a new air passageway, such as a trach. In order to determine if you have sleep apnea, go through the list of these questions and answer them honestly. Do you snore? Are you excessively tired during the day? Have you been told that you stop breathing during your sleep? Do you have a history of hypertension? For males, is your neck greater than 17 inches? Or females, is your neck greater than 16 inches? Yes to 2 or more of these is a positive screen for sleep apnea. If you answered yes to 2 or more of these questions, take this completed questionnaire and share it and show it to your healthcare provider. Thanks for watching.